there are certain concerns by the local government units, and very highlighted is the concern of the province of Cebu. And that is why we are going to give Governor GWENDOLYN GARCIA her chance for her presentation. So to the Governor of Cebu, we are recognized, Governor Gwen.
Thank you very much, Senate President Tito Sotto. Good morning, my buntag, and good morning to all of our honorable senators, cabinet secretaries, and all that are in attendance in today's Senate hearing. First of all, I would like to thank the Senate President for allowing the province of Cebu to make a presentation as regards the protocols that we have arrived at after careful analysis and study of the actual situation here in the province of Cebu, in the island of Cebu, as well as the plight of our OFWs and returning overseas Filipinos. Before doing that, allow me to make a presentation of the situation right now in the province of Cebu. And these are data that we regularly collect every day from all of our municipal health officers, all of our city health officers, as well as we compare notes with the regional Department of Health here in Region 7. In the province of Cebu, from April 20 to December 31st, 2020, we had a total of 6,982 cases or positives. From January 1st to June 13th, we logged a total of 9,150 cases. But since it would be a misimpression to just keep on counting the positive cases, especially since in this particular disease, we are actually spanning 2 years now, or almost 2 years. We did not do a reset of counting, unlike other diseases. This is now a total case from the very beginning. And so we took into account how many had died, how many had recovered, ending up with the active cases pegged at 405 or 2.5%. Of the 750 that died, we took the initiative to actually go down to the death certificates in order to ascertain whether the 750 had in fact died of COVID-19. What was our basis? What would be pegged as the immediate cause of death? And with this investigation, of the 750 logged as COVID deaths, it was only 187 that were actually COVID, or that COVID was the immediate cause of death. Other causes were heart attacks, motor vehicular accidents, sepsis, diabetes, and many other causes. And so the 549, which are listed under incidental findings, refer to those that died of other causes, and sometimes they are swab post-mortem. And if they turn out positive, they immediately are logged as COVID deaths. But in this case, the COVID positivity was incidental to the actual cause of death. With 187 confirmed as confirmed by the death certificate, 187 COVID deaths, that puts Cebu's deaths at 1.2%, lower than the DOH national total, now at 1.7%. How many are hospitalized? 85. Those with mild, moderate, and severe symptoms. In isolation, 320. That is the situation of Cebu province. We had set aside 400 beds specifically for COVID cases. What is the bed occupancy? Right now, with 81 hospitalized for COVID or influenza-like illness or severe acute respiratory infection, the total is at 13.8% occupancy, which leaves us with 79.8% of the 400 beds still available. In our isolation facilities in the entire province of Cebu, and we are speaking here of 44 towns and 6 component cities. The intended beds for COVID is 2,464. Right now, in isolation, in these facilities, is 58, or a mere 2% of the total 2,464. 98% of our 2,464 beds for isolation are still unoccupied. We culled data from the Department of Health. So what I am presenting now is actual data from the Department of Health, which lists all provinces and cities by population, by active cases, and by percentage of total active cases. But we went further because in biostatistics, we determine the incidence or prevalence of disease by 100,000. Not all provinces or cities are similarly situated geographically, more so by population and by environment. And that is why the best possible way that we could determine the severity of that disease is by getting the number of cases by 100,000. In this list, Iloilo City tops the rank with an incidence of 265 cases per 100,000. Negros Oriental, part of Central Visayas, is pegged at number 3. Now, if we go down further, Bohol is number 13, still part of Central Visayas. But where is Cebu City? Let's start with Cebu City. Cebu City is number 42. Lapu-Lapu City, again, part of our tri-cities here. We have 3 highly urbanized cities, Cebu City, Lapu-Lapu City, ranked at number 72, and Mandaue City, ranked at number 75. What is the rank of Cebu province? Oh, let me point out, Siquijor is ranked, again, another province in the Central Visayas. Siquijor is ranked number 108, while Cebu is number 120. Cebu province, with a population of 3,226,290 and active cases at 473 per DOH records, because they are usually late in updating their records. We are at a much lower rate now, but at any rate, at 473, we have 15 cases per 100,000, putting the province of Cebu at rank number 120. But let's get the entire Cebu Island. And that would be, as I mentioned, the 44 municipalities, the 6 component cities, and the tri-cities of Cebu City, Mandaue City, and Lapu-Lapu City. Cebu Island, with a total population of 4,919,667, stands today at rank number 104 in the incidence of COVID positives per 100,000 population. That is the initial presentation of where Cebu is and where Cebu stands. Again, from data culled from the DOH. In the entire, let us go province by province. Since, as I pointed out, Negros Oriental now ranks number 3 in the number of beds available, for which the province of Negros Oriental has a total of 262 beds for COVID. Because we speak here of critical care utilization, so let us go down to the number of beds, hospital beds available. There are 262 beds available, 179 are occupied, 83 are vacant, for a bed occupancy of 68.3%. Per DOH occupancy rate level, that 68.3% would now near the high risk occupancy rate level. The province of Bohol, with 296 beds available, has an occupancy of 163, vacancy at 133, and coming up to a bed occupancy rate of 55.1%. The province of Siquijor, with 66 beds available, they have 19 occupied, 47 are vacant, with a bed occupancy now at 68.8%. What about the province of Cebu, where we have a total of 1,585, including private hospitals? The occupancy is pegged at 371, vacancy at 1,214, or a bed occupancy of 23.4%, even lower than Siquijor. For the entire Central Visayas, I had already shown you the bed occupancy levels per province. There are 4 provinces, 4 separate island provinces of Siquijor, Negros Oriental, Bohol, and Cebu. For Central Visayas, with a total of 2,209 beds available, 732 are occupied, 1,477 are still vacant, pegging an bed occupancy of 33.1% in the entire Central Visayas, notwithstanding the fact that Negros Oriental now ranks number 3 in the incidence of COVID per 100,000 population. What is the capacity utilization rate in the private hospitals in Cebu as of June 13, 2021? Right now, 862 beds have been allocated for COVID, 777 for regular COVID beds, 692 are available, 619 for regular COVID, and 73 for ICU COVID. The capacity utilization rate stands at 19.7% in the private hospitals in Cebu alone. 20.3% are regular COVID, 14.1% are ICU COVID beds. We have 1,918 healthcare workers assigned to COVID patients. In fact, I think it was last month when the surge happened in NCR, we sent doctors and nurses from Central Visayas to help your hospitals in NCR. A total of 100 doctors and nurses coming from Cebu and Central Visayas. So of the 1,918, 1,088 are 888 are on active duty, 30 are in quarantine, and 170 are admitted COVID patients. Let me show you the entire spectrum of how COVID and COVID cases have increased and decreased in this entire time period from April 26, 2020 to June 14, 2021. Because as I had said earlier, unlike other diseases where we do a reset on a yearly basis when we start counting the number of cases in that particular year, for COVID-19, we are doing a cumulative total from the very beginning, which was in the province of Cebu, our first active case, our first positive case, what happened on April 26, 2020. This is the graph. We started with 3 cases. We went up to a high in 2020 of 499. And then there was a steady drop with some spikes along the way. We reached our lowest at 26 cases in the week ending December 27 to December 31, 2020. From then on, we saw a steady rise of COVID positives once again, peaking at 735 in the year 2021 in the week comprising March 21st to 27. That 735 are the number of positive cases that we were able to log in that week, March 21st to March 27. And then notice, the numbers again started to decrease in the number of positive cases on a weekly basis. Right now, as of June 13th, there were a total of 43 cases on that day. So, obviously, a steady decrease. I asked why. How could this have happened? Why did we experience another surge after January? And then we checked. On January 23rd, IATF resolution came out, number 95, and said, incoming passengers shall be tested upon arrival and shall be quarantined until the result of a subsequent test on the 5th day. This was the initial IATF resolution, double swab. But on February 1st, IATF resolution number 96 was released stating, unless the passenger exhibits symptoms at an earlier date while on quarantine, RT-PCR shall be conducted on the 5th day from date of arrival. During that time, the ROFs and OFWs were immediately sent to the hotel and would only be tested on the 5th day. Notice the steady increase of our cases. Why? We know very well that there can really be no strict monitoring in hotels. Hotels are understaffed. And if you were to quarantine thousands in the different hotels, you cannot really say that there is no interaction with hotel staff or even with other ROFs and OFWs. We have had cases of OFWs, in fact, going out of their rooms. That is our conclusion. And this conclusion has been supported by the fact that when I issued Executive Order number 17, Honorable Senators, Mr. Senate President, I had to issue that executive order because at that time, Cebu had only a total of 2,500 hotel rooms for quarantine. At that time, the mixed use policy had not yet been approved. And so, with 2,500 and with a daily arrival of around 600 OFWs and ROFs, and these 600 had to stay a total of 8 days at the time because they would only be tested on the 5th day. The test results come out 2 or 3 days later. So 600 for 8 days meant 4,800 that had to be kept and had to stay in quarantine for 8 days in our 2,500 rooms. That was why there was a cry for help. And our regional directors from the DOT, the DOH, the Bureau of Quarantine, the OWA, even Mactan Cebu International Airport, they all came, and in a meeting where I listened to all of their inputs, we agreed upon recommendation of the DOH that we would revert to the old system. Last year, before IATF resolution number 96 came out, last year, the protocol had been all ROFs or OFWs are tested upon arrival with a negative test result. On the 2nd or 3rd day, they are then allowed to go home. And as you could see in the previous graph that I showed, we were doing fine. In fact, our cases started to drop. When IATF resolution, particularly number 96 came out, with the graph that I am showing you, the cases started to rise. So DOH put forth their recommendation that we will revert to the previous system, which was working. And by reverting to the previous system, that meant swab upon arrival. In fact, the DOH was so kind as to offer that this time, that does not be an added burden to our OFWs and ROFs, we shall swab for free. So that became effective March 31st with Executive Order number 17, an executive order culled from the inputs of all the government agencies, relevant government agencies concerned. We started swabbing upon arrival. They would be sent to the hotel, stay for 2 days or 3 until the result would come out, and then they would be allowed to go home. That is when our cases again started to drop. This Executive Order number 17 was further strengthened with Provincial Ordinance 20-14-04. And so it has become the local law of the land. Because this is not a mere executive order that insists on swabbing upon arrival. In the province of Cebu, further supported by the Tri-Cities. And therefore, we call this the One Cebu Island policy. We swab upon arrival. The OFW is sent to the hotel. They stay for 2 or 3 days. With a test result, they're allowed to go home. Mind you, we can only do this for Cebuano, ROFs, and OFWs. So, what is the status now? There is not only EO number 17, there also is Provincial Ordinance 20-14-04. Last Friday, the Provincial Board met in a special session to further add to this ordinance that not only will we swab upon arrival, but to comply with resolution number 114 of the IATF, we would swab again on the 7th day. The difference there being only that once you get a negative result on the 2nd or 3rd day, you are allowed to go home, continue your home quarantine with the active monitoring of our barangay health emergency response teams. We have a very effective BHERTS system, and that is also a huge factor in the continuing low number of cases in the entire Cebu Island. Cebu, since July 21st, has been on MGCQ status. Why? Because we have all of our systems in place, beginning with the BHERTS at the barangay level. If 2 or 3 ROFs would return to a barangay, they can be even more closely monitored than 500 ROFs or OFWs quarantined in 500 hotel rooms where we do not know the effectiveness of monitoring and seeing to it that they do not go out and interact with other people. The barangay officials themselves would be just as careful and as cautious because, well, having another outbreak would not be good for us. So that is why in Cebu, things are working. We must be doing something right.
All right.
Now, I would like to show you, just for clear analysis here, we have the MCIA samples and variants of concern. From March 31st to May 27, 2021, a total of 21,666 OFWs arrived. Of the 21,000 whom we swabbed upon arrival, 99 were found positive. And 10 were sent to the Philippine Genome Center, the PGC. What does 99 over 21,666 mean? A positivity rate of 0.46%. Lower and much lower than the current positivity rates of community transmission right here in some of our cities and provinces. The samples that we sent to the Philippine Genome Center revealed the following. Of the South African variant, there was only 1 case. For UK variant, 0. For the Brazilian variant, 0. We have data of the total number of samples taken from our OFWs and ROFs that were tested in the 13 laboratories spread throughout from Metro Manila even down to Cebu in the Vicente Sotto Memorial Medical Center or VSMMC. So these data include the Lung Center, Jose Rodriguez, PNP, San Lazaro, Las Piñas, Jose Lingad, Hospital ng Imo, Santa Ana, UP National Institute, PGH, Children's Medical Center, and the CTRL as well as Vicente Sotto. 95,891 samples taken from our ROFs and OFWs. Of the 95,000, 94,000 have been released. How many were negative? 92,971, showing a positivity at 1,065, a positivity rate of 1.1%. Really very, very low. in the Central Visayas biosurveillance for ROFs and OFWs from January 22 to April 7, 2021. 170 are from the ROFs and OFWs. As we showed, only one yielded a South African variant. But there were other samples that we sent. And this is how it turned out. 12 cases were South African, 13 with for UK, 1 for what is now known as P.3, but was previously identified to our consternation as the Central Visayas variant, for a total of 26 variants. Now, why? Ready the video. Did we request?
Governor, can you please wrap up so that
Yes.
go ahead.
Why did we insist that there should be immediate testing upon arrival? Well, this is a testimony from one arriving ROF that had to land in Manila because for the past few days, flights had been diverted to Manila. And this is his testimony. At any rate, apparently the protocols have not been very well defined in Manila. When he arrived, he was made to choose whether he would take a taxi or some other mode of transport. And in arriving at the hotel, he was informed that he may still go out, do some groceries for basic necessities, because when he said his quarantine would start, he could no longer go out. He practically was amazed that he was still allowed to go out. The question that he asked was, what if I already am infected and yet I am still allowed to go out? When the flights were diverted, I hear of horror stories now of OFWs and ROFs that had no more rooms. Because with 1,500 arrivals in Manila and needing to be quarantined for 10 days, and the additional 300 a day or 3,000 coming from Cebu, that necessitated a total of 18,000 rooms. Some of them had to go as far away as Tarlac or even Tagaytay. Of the OWA, MCIA arrivals, we can do the math. Instead of paying for 3 days, we pay for 10. That's 2,500 times 3 or 2,500 times 10. For the OFW, for returning Filipinos, it's not OWA that pays. They have to take that from their own pocket. And so it has repeatedly been insisted that it was the science of it, that we must follow IATF. Well, I have presented our own science, backed up by our own chief pathologist, Dr. Jean Loreche. But more than the science, we must also think of the human consideration as well as the heavy financial burden of having to keep our ROFs and OFWs for 10 days quarantined in the hotel when the science of it has shown that the positivity rate for MCIA arrivals is at 0.4%. For the total 13 testing centers, it's 1.1%. So I rest my case. Thank you very much, Senate President.
Thank you, Governor Garcia. I think you were able to drive home the point very well.